Hello guys, welcome back to the channel. I am Enzo and today we are here at Zipline for C here at Upper East region, and we have a very good and informative video for you. Let's go inside and check out what they have here, because this very facility or this initiative have been saving a lot of lives. Before we go in, don't forget to subscribe if you are new here. Leave a comment.
You're welcome. This is the Zipline Fulfillment Center. This current distribution center is in Vopsi. This area is called Vopsi, but we are in Waliwali, a few minutes from Waliwali. It's the third distribution center in Ghana. Ghana currently has 4. The first one is in around Suhum, Omenako. The second one is in Impanya. This is the third one, and the fourth one is in Sefiri also. So those are the 4 distribution centers. The tour will be in 2 phases. We are going to give you a tour of the fulfillment warehouse. When we say fulfillment warehouse, it basically has to do with everything that we send across, like the blood, the medical products, the vaccines that we send out, how inventory is managed and all that. Then finally, we'll see how the drones are flight. That's what is like excites everyone. So we'll see how that goes. So I'm going to show you how you're just going to cover your foot when you are going in. And so you do this, you enter the red zone, then you make sure your other foot is not in, then you cover your other foot as well, then you step in. So you need a lot of balance. You can sit and do this. Yeah. So for you can just put your foot there, just put it in the cabinet, then walk here. So I give you one bit. Okay. So welcome once again. So this is the fulfillment warehouse. We're going to go through a tour about how like everything is done here, all the processes that we undertake. So you can see that we have some products on the shelf. I want to take you through how the products end up on the shelf. So just as if you are working in a supermarket and you are selling bread, pure water, it's coming from somewhere. So definitely we have some upstream suppliers that serve us with all the products that we have. The classes of products we have: medical products, vaccines, blood products. And since the COVID pandemic too, the government of Ghana has has taxed us to send out personal protective equipment and also COVID samples to testing facilities. So for the Omenako, the first distribution center sends COVID samples to Nuguchi. Then the second distribution center in Impanya sends COVID samples to KCCR testing facilities. Yeah, so some of these things, yeah. Our upstream suppliers are the regional medical stores for here, Northern and Upper East. Those are the people that give us the medical products. For the vaccines, we have expanded program on immunization, EPI. And for the blood products, we have the National Blood Services. And these, the National Blood Services works with the zonal blood services. So specifically for this place, we work with the Bolga Regional Hospital, the zonal center.
So those are bloods donated by individuals to
yes,
them?
Yes,
that is given
exactly.
To
so they just serve as upstream suppliers where we take these products from. Yeah, and yeah, let's stop here. So one unique thing that you will see when you look at the products on the shelf is that every product you see has a zipline barcode. It's an alphanumeric number that identifies this product uniquely. So when I pick this product from the shelf and I scan the product, I scan the product in our system, you would find the name of the product pops up, the weight of the product pops up, batch number, expiry date. Every single product that you need on every single thing you need on this product pops up. Just so when you watch CSI Las Vegas and you get someone's fingerprint, like the data, exactly. So that's how it works. So it's a unique identifier for this particular product. Before this ends up on the product, we do something we call visual inspection. When the product comes in, so we check out for leakages from products that are like in liquid form. We check out for leakages to make sure that the batch number on the product correlates with the batch number here, expiry date correlates, and every other detail on this box correlates with what we have on the product. We also look out for things like for injections or vials. We look out for broken vials or ampoules that are broken. I'll show you an example soon. So we look out for all these things. If we notice that there's any issue with any product that affects quality, we don't accept it into the fulfillment system or the Zipline inventory system. So when a product is given the green light, then we assign this code to the product. That is why you see codes on all the products that we have here. Yeah. So that's how the receiving is done. We here at Zipline receive calls from facilities, or we communicate with our facilities using 3 main methods: the phone call, the WhatsApp message, and the text message. So these are the 3 methods that people can reach us with: phone calls, text message, or WhatsApp message. When that is done, so for instance, when I receive a call from a facility, this is my order taking interface where I receive the orders from. We call it the customer service view. Mind you, this is like an internally generated software that we use to manage inventory here, send out orders, add orders, pack orders, and all other things. So you go to the add order tab, then you select the method that the person contacted you with, whether it's a phone call, a WhatsApp message, or a text message. Then after that, you select the orderer who is ordering. So maybe Dr. A from facility B or Dr. C from facility D. We need to indicate that. Then the next thing that we indicate is the type of order. Here at Zipline, we have 3 types of orders. We have emergency orders. So for instance, if you have a cousin who has been bitten by a dog and is sent to the hospital, needs anti-rabies, he gets to the hospital there and then, so it's an emergency. So you have need of the product there and then. For resupply orders, for instance, I need paracetamol in my facility, but no one has come yet to use the paracetamol, but I want to keep it in my facility because I want some minimum stock. So those are resupply orders. And for scheduled deliveries, just as the name suggests, maybe you book, you are buying something from Jumia and it will be delivered to you tomorrow, and like you can track it. So that's how the scheduled delivery works. You tell me that, oh, we have a vaccination clinic tomorrow and we need so and so vaccines, so deliver it at 8 a.m. tomorrow. That's how the scheduled function works. So when you select the type of request, the final thing that you select is the product that you want, whether it's paracetamol, whether it's an analgesic, whether it's an antibiotic. You indicate it there, the quantity, and whether or not the facility has stock. Then you submit it. Immediately you do that, the order moves from this interface, which is the order taking interface or customer service view, to the packaging interface where we can pack the products for delivery. Yeah, do you have any questions at this point?
All right. So what I basically want to ask is, most of these medicines, like you said, are from the regional
medical stores. Yes.
Why should they deliver it to this place instead of the hospitals directly?
Exactly. Zipline is here because we have quite some challenges in the Ghanaian healthcare supply chain. The top or the chief of them is the fact that the facilities that we work with, some are not motorable. They are hard to reach. Okay. So a classic example is a district that recently reached out to us because their district has been totally cut off by the seasonal rain. So it's very important that we step in to help deliver these products. Okay. As you classically know, the drones defy terrain. So whether the road is bad or not doesn't affect the drone. So our drones can fly over all these challenges and impediments that we have with our roads, our road network. That is why it's very important that Zipline is here. When we go into the tour, we would explain why really this is necessary, so that you would get the clear picture of how these things work. Yeah.
I think here with pharmacists or doctors or just if the medicine comes in, the number of the medicine comes in, then you are just to deliver that with
Okay. So if I get you right, the kind of backgrounds that we have here, allied health professionals. Personally, I'm a medical laboratory scientist. We have pharmacists here, we have doctors here, we have nurses here, we have nutritionists. So these are some of the backgrounds that we work with. It's very important because our products, we have blood products that the medical laboratory scientists will be more conversant with. We have medical products where the pharmacists will have to step in and all that. So we make sure we cater for all these groups, so that when we need expertise on any of these groups, anyone can just come in and help us with what we need. Yeah, so those are the backgrounds that we have. Zipline doesn't make any technical decisions on behalf of the facility. So if you're a doctor and you call us and you need so and so products, all we do is to deliver that product. We don't tell you that why not order this, why not. No, we don't do those kind of decisions here. Yeah, we are a logistics company. We deliver what we have and what you need.
So in this case, it means that the doctors you are working on, any health professional is is a professional.
Yes. So we don't deal with patients. We deal directly with the healthcare professionals. So when a nurse calls me or a disease control officer calls me and needs a vaccine, we know that that's a person who has been fully trained to know how to administer these products. Yes.
And are you only working with government hospitals or you have private hospitals?
We currently work with government hospitals that are under NHIS.
Okay. Oh, okay, under NHI. So
Yes,
does it mean that NHI covers all the medicines?
Yes, a significant amount of the medicines that we have here is covered by NHIS here.
So if there is a private hospital or clinic who has NHIS accredited,
Yes,
they can.
we can, yes, we can do that.
Okay, so they have to contact you and go through a process.
Yes, we do training for the facilities. They need to understand how the system works before we can start serving them. Yeah, so we go through all these processes before. Yeah. Okay, so going on, I want to, we mentioned earlier, when the order comes, it is submitted into the system. So we need to go through how, like, the order is packed. So this is how, this is what the orders are packed in. This is the red box that we have here. So this is how the orders go out. So the box we have currently is made up of 3 main components. The red part we see is made up of biodegradable paper. This is the red box we see. Then we have an air insert, which is made up of rubber. This is what helps with buoyancy. Our drones don't land. When they get to the facility, the drop mechanism opens up and the box falls in gently. So the whole idea is that we want to put systems in place so that the integrity of the products in there will still be intact when it gets to the facility. Let me give you a classic example of some of the products we have and why they need to do that. So we have products like this that comes in ampoules and they are internally fragile. So we need to put systems in place so that when they get to the facility, this will still be usable. Yeah, that is why we put all these systems in place. What you see on the packing table here is another material that is used to pack. This is dunnage that we used to pack, or insulation paper. The way the material has been made, you see how the lattice forms. It makes sure that when you wrap a product in it, let me use this as an example. When you wrap a product in, the product is still intact even if it falls from a higher place. So these are some of the systems that we put in place so that the integrity of the product is kept from the time it leaves this place to the time it gets there. I will go a little into some of the temperature sensitive products. So we know vaccines are temperature sensitive. They need to be kept in an optimum temperature range. So for products like that, we add something we call ice packs when we are wrapping it. So we know that, and all these processes have been thermo validated, knowing that from the time it leaves the distribution center to the time it gets to the facility, it will still be in the optimum range for the facilities to use. Yeah. Okay, I'm going to go ahead to go through some of the equipment that we have here. So the first fridge that you're seeing is the fridge for the blood products. Okay. One thing that resonates with the whole zipline service is speed. Okay. And accuracy when it comes to the deliveries that we do. Right. So we, from the time the order comes to the time the order leaves the distribution center, from the time the order comes to the time we hand over the package to be sent out to the facility, it's supposed to take about just 3 minutes. So that's why we put all these systems in place. The fridge is appropriately labeled, so when you enter the fridge, you know where exactly you are picking out from the fridge. You know which component you are taking, which component of blood you are taking out. So all these things have been put in place to make sure that the process is as seamless as possible, and it adds to the speed with which we can work. This fridge contains the vaccines that we send out. So all the vaccines that we send out are from this fridge. The first, the second, third, fourth fridges are all for vaccines as well, as you can see. So this is how it looks like. The final cooling device is a freezer, and what it does, or what it has, is it contains the frozen component of blood, which is the fresh frozen plasma and the cryoprecipitate. This is the fridge that houses these products. One would ask, like, why is it even important to go through all these things when people come to see us? Let's take a classic example. You all know TTH, right? So you don't know? Okay, this that's Tamale Teaching Hospital. Oh, yeah. Okay. So imagine all these fridges were at TTH, and they had the products that we have now, and a facility in Wale Wale needs the product. Yeah. You know the number of hours it takes. Yeah, exactly. So the whole introduction of the zipline into the Ghanaian healthcare supply chain is the fact that we are centralizing the stock so that every facility will have equal access to it. Wow. So some chips compound in like a village somewhere will call in to order for 10 bottles of paracetamol syrup, or a bigger hospital, maybe BMC, Baptist Medical Center, will call in to order for fresh frozen plasma, or like a facility in maybe the Talinsi district or Karaga district, a very like small facility will call in to order for something. If all these products were somewhere else, we would have needed like a lot of logistical like means to bring them to where they need them. But with Zipline, all the stock is centralized so that anyone who needs the product will have equal access to it. So then the healthcare supply chain like provides equitable service to everyone that has need of them. That is why like it's really important for us to do this. So I'm sure I've answered your earlier question.
The need for
Exactly. So if everything is at one place and we have a means to send it that defies terrain, then it's really a good deal, or it's really a good thing initiative, because whether seasonal rain or for instance COVID, at the point we were not even supposed to have contact with people, so this is contactless and all that. So all these things are some of the like perks of like the Zipline distribution service that has been introduced in Ghana, and it's really like a solid service.
So you are in contract with the government.
Exactly. It's a private public partnership.
Okay, the private public partnership.
Exactly.
So it means the government is paying you
for the service that we're dealing. Yes.
But not for the medical.
No.
Okay, so
no.
Okay, the government is supplying you the medical.
Exactly.
So that you give it to people.
Exactly.
Okay.
Exactly.
Okay.
Exactly.
Amazing.
And the health facility that we work with do not pay to Zipline.
Okay.
They still pay using their normal means, like paying to the regional medical store. Exactly.
Okay. So
and
you are like a delivery.
Exactly.
company.
How a delivery man works.
Okay.
That's how we work. It's a logistics company. So when we take the product at 1 CD from the government, it's still 1 CD. When we take it 2 CD from the government, it's still 2 CD. Zipline doesn't add any extra cost to any product that you see here. All the program medications, like the vaccines that are sent out free, it's still free when you take them from Zipline. So these are some of the things that people don't know and like would have to be enlightened on, because we don't like interact financially with any institution. We don't take money from them. They are still supposed to pay using their normal means of payments. Yes. Yeah.
So do you really think this is something that African countries need to pick up?
It's really important, just as I mentioned, because we have videos of like the facilities that are currently being affected by even a classic example is the seasonal rain. Some facilities have been cut off completely, and we still have pregnant women in there who need products. We have children in there who need vaccines. We have people women who go through labor and still need blood. We have patients that are getting sick on a regular. And we are in the malaria season where people rely on a lot of anti-malaria medication. So it's very important that we have a system that defies things like terrain. So you need a facility that's like 2 hours away can be served in under 30 minutes.
Okay.
Exactly. So all these things like bring the service into perspective, because we get all these benefits from the service that we currently render. So we need to look at all these things. Yeah.
What's your source of electricity?
Okay. So let me start from the equipment. So this equipment, for instance, is powered by the normal grid, the national grid, but this equipment has a backup battery that lasts for 24 hours.
Oh, okay.
Beyond the backup battery, we have another one, which is the UPS, that can last us for about 24 to 48 hours. Okay. Beyond the UPS, we have a plant that can last us as long as we want.
Oh, okay.
So all these backup systems have been put in place. We understand how very important our service is, so all these things have been put in place so that we ensure that our products are kept in the optimum range and everything, all the quality processes are followed. Yeah.
So are you able to fly even during rainy seasons?
Rain or shine.
Rain or shine. Wow.
Yeah. Rain or shine. So currently we do a 16-hour shift. We start work at 7 a.m. and close at 11 p.m. However, if a facility needs a product as an emergency, if you call me at 1 a.m. I'll respond, 2 a.m. I'll respond. So currently it's not a 24/7 service, but for emergency deliveries, anytime you reach out to me, I'll respond. Yeah. Or any of us will be willing to respond to you. Yeah.
That's such a nice.
Yeah, it is. Yeah, our accommodation is not far away from this. There's a few seconds away, like 5 minutes. You saw that elegant. Yeah.
I wanted to ask a question, but
it just skipped. No problem. When it comes, I'll just answer.
Okay.
Yeah.
So concerning the faraway hospitals.
Yes, please.
Like teaching hospital, which is quite far from this place. How many minutes does it take?
So the distance depends on how long it is by road. So I can just give you estimates. I don't we work with 200 and something facilities, so it's hard to keep up with the times.
Upper East.
A lot of regions, not just Upper East, Northeast region. this facility. Yes, we work. This current distribution center serves about 250 something facilities.
Outside and inside of the package.
Within the 80-kilometer radius that we serve. So we serve different districts in different regions.
Okay, so which means the drone flies to 80 kilometers.
80 kilometers,
Okay,
yeah.
so if you are
within a
within the
straight
80
80-kilometer radius,
you are
yeah,
at
you
service.
pick up. Yes.
Okay, wow,
So the same as Omenako, which serves about 600 plus facilities. So depending on the saturation of health facilities you have around your distribution center, yeah, it gives you a rough figure of how many facilities you serve. Yeah. Okay, so this is the flight operations area. So this is where like the drone action takes place. Just like we have like different versions of phones, the current generation or the current version of the drone we have is called the Sparrow, and it has 4 major components. So the first part is the wing. This is the wing that you see. It spans about 3.3 meters in length. So this is the first component. The second component is the battery. So the batteries that are blinking are batteries that are like charging, and the ones that are blue static lights are batteries that are fully charged. These are the batteries, and they are sitting on something we call the battery, the smart charger. So this is the second component. The third component is the body of the drone. We'll look at the body of the drone shortly, and the final component is the nose foam. That is what she's holding. So this is the nose foam. This is the fourth component. So as I mentioned, the wing is the first component, battery, then we have the body of the drone, then the nose foam. So let's look how the body looks like. So this is a safety area. So before you get in here, you are supposed to wear your safety glasses. So each one of us should, yeah. If you are wearing glasses already, that's fine. So yeah, we are ready to go. So as I mentioned, this is the fourth component, which is the body of the drone. So as you're seeing, what he's doing is that he's scanning a QR code on the box that I showed you inside, and he's scanning a QR code on the body of the drone. What this activity does is that it assigns the package to the drone. So when the drone leaves the distribution center, the drone knows exactly where it's going. So that's what this is for. Yeah. So let's just take note of how the insertion is being done. All right. So he closes the compartment. Yeah. So we are going to see how a launch is done. And when we say launch, is the drone leaving the distribution center, and how a recovery is done as well. It means when the drone comes back to the distribution center, how we capture it from the air. So we are going to see how all those two things work. Is that okay? All right. These are engineers, so they will understand the system better, but I'll explain as much as I can. So the apparatus you're seeing now, the A-shaped structure, is our recovery system. So this is what captures the drone from mid-air when it gets to the distribution center. It communicates with the drone using a network system we call the line of sight. So when the drone is almost at the distribution center, it sends like messages, about 20 messages per second to the recovery system to let it, in simple terms, know that like I'm coming back to the distribution center, so like get ready for me, something like that. Yeah. Initially, the two black poles we are seeing in between were like vertical, but because the communication has been done, it has to prepare to capture the drone. So you are going to see how that capture process is done. The direction of the pole means the drone is going to recover from the left, and this is highly affected by the wind direction. So depending on the direction of the wing, please come here. So depending on the direction of the wing, the drone can either recover from the left side or the right side.
Okay.
Yeah. So we're going to see how shortly how this is done in a few seconds. Okay, so the drone is coming back. Okay. Yeah. Mind you, this process is supposed to be as precise as possible because the capture is done. This part of the drone is what is captured. This is the tail hook. It's very small, so the process will have to be as seamless as possible to make sure the capture is successful. Yeah.
Are there instances that have failed to catch the drone?
Yeah. That happens in like 1 in 1,000 recoveries, or 1 in like 900, 800 recoveries. And as I mentioned, one of the factors that this system uses is the wing direction. So there are times when like it passes over the recovery system and the recovery is not successful. And what the drone basically does is that it goes round a hold and tries again, and mostly like the second try it's successful. So the wind direction can cause like a miss, but it just goes round and tries again from a different direction if need be. So when it's successful, then the flight operators, who are engineers, will just go and like take the various components apart. Okay. One thing I didn't mention was like the part why like we have a modular system. Like when it comes to the drone, imagine like our bodies had different parts that needed to be put together like a Lego. If one part is not working, you can just pick another hand and just So that's basically the principle. They are called line replaceable units. So anytime when one is not functioning, well, maybe we have like a tear in this styrofoam, we can just pick another one instead of changing the complete drone. Yeah, exactly. So you can change the battery of your phone and not need to buy a new phone. Yeah, exactly.
So what you saw me do was like the black and white, like I would call it, because that you see actually the zipline. So anytime, okay, when you see the white one is the one that is now going to deliver at the facility. When you see a black one, it has delivered, it's now returning. So what I actually did was, I was just trying to minimize the screen. We call this a sky map. It's a transit plan. All the white fighters that you see are the routes that the drones use to get to the facility. And the red pointers that you see all represent the facility. Yeah. So we know we are in the northeastern part of Ghana. Yeah, but we serve as high as the upper eastern part, and we have one facility that goes beyond the border. It's just at the edge. Yeah. So this is where we are, the green point. Yeah. And then we deliver all the way. So you can see this is Bogatanga, and then you have Paga and Boko around here. So these are all the facilities that we deliver to. Yeah. So we have some going to this direction, we have some going here. So we mostly just minimize it to kind of have a fair view of everything that is happening. And if I just want to focus on just one drone, I just tap the drone. So you see it has zoomed into it. Yeah, so I can now see everything that is happening on the drone. So the round things that you see, we call them poles. So let's say as we are flying, you know we are governed by the aviation like the military. So maybe they call us that the military is like having a patrol and exercise with a helicopter. That means the drone has to be kept like in a safe position so that it doesn't collide with the helicopter. So these things are there so that the drone can be able to hang around there until the military exercise is done before we release it.
So they would alert you.
Yes.
And then so at what speed or at what acceleration does the drone travel?
Okay, so can you come closer?
It varies.
It depends, but most of the time we have between 28 meters per second to 30. So that is what you can see here, the airspeed. Yeah, so that is the current speed that this drone is traveling with. So we can maybe go to another one too. So you see it's also at 28 meters per second. Yeah. But the Hornet is coming in to recover. It drops to 22 meters per second. Yeah. So I think she was telling you something about the different. You were asking if they could come from the left or the right. So I don't know if you remember when we were kids. We used to put some cloth around us, and then when we are running, you see the wind blowing in those directions. So when the wind is coming to recover, when it has an opposing wind, it breaks, it slows it down. And we need it to be at its lower speed to be able to let this catch it when it's coming in for recovery. So anytime the drone senses that more wind is blowing from this direction, we always try to meet the wind head on so that our help releases it. So if most of the time it comes from this side because we have a lot of what we call here tailwind coming from this direction. But then if it senses that the wind is blowing from this direction, we'll now recover from this side so that it will help it to slow down. Because if it's coming from here and the wind is blowing from this tail, that means we give it more speed and it might miss the capital line that is happening. So we have to make it in such the drone is smart in such a way that they are fully autonomous. When we send it right now, everything has been programmed, so it will take all the decisions by itself. When it senses, let's say, high wind or anything that can make its machine go wrong, it will quickly trigger, we call it an exception, or it will trigger a fault, and then quickly come back for us to be able to look at whatever is happening. So there are a lot of things that our drones are able to do that I would say average or ordinary drone can. So they are really smart. And I think so far we've done 95 flights. That's why you have most of them. But in this part of our area, like, we have a lot of facilities. And when you see the drone traveling for like 44 minutes or 30 minutes by road, that could take you as much as 2 to 3 hours. Yesterday we went to a facility that is just 5 minutes away by the drone, but going by car, it took almost 30 minutes to get there. So that shows you how fast our drones to
HC 587.
The route has been preloaded embedded in the battery of the drone, so the drone knows exactly where it is going. Immediately that process, the confirmation process, is done. So all these things you see are the drones that are from a facility or going towards a facility. So all these, so when it knows that it's carrying a package to Tola Presby, the drone knows exactly where it's going, which route to use and all. Yeah.